he will not depart from it. Ephesians chapter 6, verse 4 says, "And you fathers, do not provoke your children to wrath, but bring them up in the training and admonition of the Lord." We're going to celebrate Father's Day in a couple of days. And I just wanted to share with you some thoughts on the value of fathers. There was an article in, I believe it was Time magazine a few years ago, and it stated that the single most important factor in a child's success is the presence of a father. 85% of all youth in prison come from fatherless homes. 71% of all high school dropouts come from fatherless homes. 90% of all homeless and runaway children come from fatherless homes. 75% of adolescent patients in chemical abuse centers come from fatherless homes. 63% of suicides are from fatherless homes. 70% of youth in state-operated institutions come from fatherless homes. 85% of all children who show behavior disorders come from fatherless homes. 80% of rapists come from fatherless homes. So it tells us that as we prepare to celebrate Father's Day, that fathers are very, very valuable. And we live in a country and in some cases a world where fatherhood is an afterthought. But I just want to, first of all, celebrate the fathers in this place, in this country, and also to remind us of the value of fathers. Fathers are important. When fathers are in place, things go differently. You know, I remember, and many of us remember, growing up when your mother would say to you, "Wait till your daddy come home." Father represented authority. Father represented discipline. And the father brought stability. So we need to ensure that we encourage our men to be good fathers, not just to have children, but to be good fathers. Because fathers make a difference. When we look at a lot of the problems that we have in our country today, the crime and a lot of other social ills, a lot of it is associated, just like these statistics, with missing fathers. So I believe we need to put a premium on ensuring that, first of all, we be good fathers, and that we help to develop young men to be good fathers. Amen? Let's bow our head. Father, we just thank you again for another day. Thank you for an opportunity to conduct the business of the country. We thank you for wisdom and understanding so that we may deliberate effectively. We thank you for a favorable outcome today over these proceedings. In Jesus' name. Amen. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread. Forgive us our trespasses, as we forgive those who trespass against us. Lead us not into temptation, but deliver us from evil. For thine is the kingdom, power, and the glory, forever and ever. Amen.
Good morning, honorable members. Honorable members, when the business of this House was suspended on yesterday because of an interruption of broadcast signal, the honorable member for Bamboo Town was on the floor. I've seen and heard some statements with respect to what happened yesterday but I want to assure the public that the information that I receive and accept was that white men doing work in the downtown area had accidentally ruptured the fiber optic cable of Cable Bahamas. That it had nothing to do with the electronic handbag, nor did it have anything to do with the ZNS, the Bahamas Broadcasting Corporation. It was simply a situation where the cable was accidentally, I guess, rendered inoperable. Thank you, Mr. Clark. And so, in that circumstance, the Honorable Member for Bamboo Town is given the opportunity to start afresh from the beginning, if he chooses, to make his presentation to Parliament. The Chair now recognizes the Honorable Member for Bamboo Town.
Thank you so much, Mr. Speaker. Mr. Speaker, good morning. This is the day that the Lord has made. We will rejoice and be glad in it. Mr. Speaker, we know his mercies are new every morning. And we want to thank him for new mercies. For indeed, Mr. Speaker, it's because of new mercies that I know, Mr. Speaker, that we in this Bahamas, we will recover. Mr. Speaker, the road to recovery for us in the Bahamas is not an easy one. However, with the 7-pillar accelerated Bahamas recovery plan that was tabled by the Most Honorable Prime Minister and Minister of Finance, we chart our steps to rapidly return to a sense of normalcy. Mr. Speaker, my ministry looks forward to participating in the rollout of that plan. Healthcare improvements and vaccination form the 3rd pillar of our accelerated recovery plan. Accordingly, the Ministry of Health has been allocated some $297,081,014 for this upcoming fiscal year to support our actions. Some $223,455,825 for the Public Hospitals Authority, $45 million for the National Health Insurance Authority, and $47,474,124 for the Department of Public Health. These appropriations will facilitate 4 areas of our healthcare sector. First, Mr. Speaker, substantial investments in the health infrastructure. Second, expansion of telemedicine to improve access to healthcare. Third, expansion of universal healthcare coverage via the National Health Insurance. And fourth, enhancements of supports to mitigate COVID-19, including vaccinations. Mr. Speaker, we are a government committed with our whole heart to the enhancement of our healthcare system. The focus is on saving lives, improving health outcomes, and putting much more care into the word healthcare. Mr. Speaker, we realize that in order to further achieve our desired outcomes, we will have to greatly improve our health infrastructure throughout the nation. We have taken the decision to renovate some structures and to build new ones. Consequently, renovations will be made to the priority wards and patient care environments to address bed shortages while ensuring compliance with COVID-19 space requirements and infection control practices. The intended goal of these improvements aligns, Mr. Speaker, with the core value that all individuals and communities receive the health services they need without suffering financial hardships. Mr. Speaker, our infrastructural plan incorporates as its basic consideration the following: the provision, Mr. Speaker, of par excellence service and environments, and prioritizing our clients, the Bahamian people's privacy, dignity, and confidentiality. We will incorporate the latest use of smart and green technology to provide for safe delivery of routine medical services. We will incorporate the proliferation of e-health services and telemedicine and the safe management of all infectious diseases, including COVID-19. Mr. Speaker, buttressed by funding acquired from the World Bank, the Multilateral Investment Guarantee Agency, MEGA, and the Inter-American Development Bank, the IDB, the government will transform the face of the healthcare sector to modernize its facility to reflect universal. We will do so, Mr. Speaker. We will reflect universal healthcare in the Public Hospital Authority, the Department of Public Health, the National Health Insurance Authority, and the Ministry of Health. Mr. Speaker, we will start with the infrastructural improvements in the Public Hospitals Authority. Mr. Speaker, PHA is responsible for and has oversight and management for the Princess Margaret Hospital, the Sandlands Rehabilitation Center, the Rand Memorial Hospital in Grand Bahama, and the clinics in Grand Bahama, including Sweetings Key and Grand Key. On the 16th of March of this year, 2021, the Cabinet of the Bahamas authorized the PHA to access loan funding of some $89,036,855.95 from the World Bank, MEGA, to fund the capital works in PHA. These projects are to modernize the infrastructure of the Princess Margaret Hospital, the Sandlands Rehabilitation Center in New Providence, and the Rand Memorial Hospital in Grand Bahama. Mr. Speaker, this year and next year at the Princess Margaret Hospital, renovations will take place in the following locations: the I Ward, Female Medical 2, the former Physiotherapy Unit, the former Female Surgical 2, Children's Ward, Male Medical 2, and the Decommissioned Intensive Care Unit. Mr. Speaker, at PMH, we will complete the phase 2 of the Urgent and Emergency Care Project. I am pleased to advise the general public that construction on the enhanced emergency department facilities initiated as part of the Urgent and Emergency Care Project is near completion. The first phase of this project at the Princess Margaret Hospital will enable us, Mr. Speaker, to expand the emergency department by relocating the outpatient spaces. Having started in November of 2019, the first phase will conclude early in this upcoming fiscal year. These initial works include an extension to the current emergency department for a new entrance. And Mr. Speaker, we are within days of completing it. This is the current entrance as it looks now. Mr. Speaker, of our new urgent care emergency center entrance, covered way for our ambulances. Mr. Speaker, this is the entrance area, which is just about complete. They also include, Mr. Speaker, relocation of the orthopedic and wound care services. And I want to show you the pictures of the orthopedic and wound care services area. This is the orthopedic reception area and waiting area. Current photos. Casting room. We'll be having the Prime Minister and Minister open the area very soon. Mr. Speaker, a dedicated biomedical service space and a covered ambulance bay, as it's seen from the photos. Mr. Speaker, the second phase of these works to the emergency department will commence in July of this year, utilizing funding through the meager loan facility of $6.4 million. This landmark project will address long-standing challenges at the hospital's front door for patients in crisis. Renovations will emphasize upgraded treatment rooms and equipment, enhanced security and privacy, and general improvement to the aesthetics of this service. Mr. Speaker, Bahamians can realistically expect that the efficiency, the throughput, interconnectivity, and overall public and patient experience for life-saving and urgent care services will be greatly improved in PMH's emergency department. Mr. Speaker, we will also acquire new radiology equipment for enhanced clinical care and support delivery of new modalities of care at PMH. Mr. Speaker, with the corresponding improvements to the polyclinics in New Providence, patients seeking non-urgent care at Princess Margaret Hospital will be redirected to the Department of Public Health Facilities. Additionally, Mr. Speaker, at PMH on-site during this fiscal period, we will construct a new infectious disease unit with a state-of-the-art HVAC system, air conditioning system, complete with negative air pressure, ultraviolet lights to bathe the air handler coolers, and MERV 20 filtration filters, in addition to antiviral and antimicrobial construction materials, so that we can ensure the proper treatment for all potential infectious pathogens at PMH. Mr. Speaker. Mr. Speaker, further, under the ambit of the Public Hospital Authority, I am pleased to present to you that during this budget period, we will undertake the construction of a new 6-story tower at the Princess Margaret Hospital. The new construction will be a 96,288 square feet, multi-storied medical, surgical, and maternal and child health tower near the present critical care block. Mr. Speaker, this tower will enhance the service delivery model, increase the service capacity, and expand the scope of services provided with limited disruption to service delivery. The tower will also provide easy access and flow of patients on the inpatient wards that accommodate the primary users of the intensive care, neonatal intensive care units, and operating theaters. The new tower, Mr. Speaker, is expected to house a new obstetrics, anti, pre, and postnatal, and gynecological ward, a children's ward, surgical ward, medical ward, private hospital boarding rooms, and auxiliary services. Mr. Speaker, this is just the first rendering as the design and drawings are underway. And as you would be able to see, Mr. Speaker, there's even provisions for what may be coming, a helipad, so that during times of hurricane and emergencies and other disasters, Mr. Speaker, we would be able to fly folks directly to that site. This new medical, surgical, and maternal and child health tower has been designed by Digges and Associates, supported by the Begg Group, a well-known healthcare planner headquartered in Atlanta, Georgia. Mr. Speaker, the tower design and construction is climate resilient, it's smart, and green energy efficient. The new tower will be constructed using a modular design at an estimated capital cost of some $55 million. This will include the cost of furniture, fixtures, architecturally significant equipment called ASEs, and information low voltage systems and other IT related systems that are necessary for the healthcare environment. Mr. Speaker, we have heard the cries of our patients, the Bahamian people, for better facilities to accommodate, treat, and assist our expecting mothers to bring their children into this world. And with this new edifice, this new 6-story tower, we in the Free National Movement will have delivered. Mr. Speaker, I look forward to us cutting the ribbon on that 6-story tower in the new upcoming term of the Free National Movement. Mr. Speaker, I now move to Sandlands. In terms of infrastructure, Mr. Speaker. Mr. Speaker, renovations are also planned at the Sandlands Rehabilitation Center, specifically for the renovation of the old Robert Smith building in a 6-bed acute psychiatric admissions ward, and the renovations of the PS ward to reinstate 12 beds within the geriatric hospital. At Sandlands, Mr. Speaker, we will also construct a new building to accommodate the provisions of psychological services currently being delivered in the Tim McCartney building. Mr. Speaker, we will now move back to PHA's infrastructural work now, Mr. Speaker, in Grand Bahama. As you're aware, Mr. Speaker, after Hurricane Dorian slammed into the island of Grand Bahama, the Rand Memorial Hospital was inundated with up to 3 feet of contaminated water for over 72 hours, 3 days. Mr. Speaker, patients had to be evacuated to numerous sites within Freeport, including the new Sunrise Medical Center, the radiology and lab area, and all of A&E Pine Ridge were not flooded. They continued to operate while the Dye Psychiatric Ward was reconstituted into medical and surgical ward spaces for acute admissions. Mr. Speaker, more than 75% of the facility sustained significant damages, including the loss of operating rooms, ward space, and administrative areas with loss of equipment, supplies, and the inherent introduction of mold and bacteria. Operational services within the RAN were limited to emergency, trauma, radiology, and laboratory departments only. Mr. Speaker, this government decided to authorize the Ministry of Finance to disburse $18 million from the Hurricane Dorian Fund for the immediate restoration of the RAN Memorial Hospital. Mr. Speaker, it was determined that investments would only be made in salvageable areas of the RAN, taking into consideration termite damage and mold growth within the facility. With that in mind, Mr. Speaker, this administration was busy creating jobs with the awards of contracts to several local companies totaling some $11.6 million. These contracts included construction works that led to the recommissioning of the RAN Memorial Hospital 2 months ago on the 23rd of April, 2020 by the Honorable Prime Minister. Mr. Speaker, the newly commissioned spaces included the complete renovation of the front entry space. And Mr. Speaker, this is what the front entry space currently looks like, Mr. Speaker. The new foyer area. And I am pleased to announce, I saw a video talking about folks not occupying the space. Patients have now been moved and are being moved from other sites back into the RAN. Mr. Speaker, the complete renovation of the pharmacy space and operations have also taken place. 3 pictures of the pharmacy waiting area, working area, and prescription windows. Mr. Speaker, we have complete the renovation of the Lula Knowles Pediatric Ward as well, Mr. Speaker. And there are 2 photos of that ward as well. Mr. Speaker, we've also completed the renovation and restoration of existing operating theaters, the renovation and restoration of the inpatient ICU medical and surgical bed space in the medical and surgical critical care block, the completion of a chapel now on site for spiritual healing at the RAN, and the completion of an upgraded commercial kitchen cafeteria facility with a very large dining area. Mr. Speaker, these are the photos of our new chapel, where both pastors and their parishioners can go while being assisted from the physical health side. Mr. Speaker, further, at the RAN, there is the construction of a new corridor to access the medical surgical ward and healing garden space, along with the restoration of the other main arteries of the hospital. So we're looking at the totality of care in the healthcare sphere and space and environment. Mr. Speaker, here is the corridor area. The new corridor to access medical and surgical ward and the healing garden space. And Mr. Speaker, this is the healing gardens area that within the next week or so, we will have fully addressed with the planning, the greenery, the flowers, the other parts of it. Mr. Speaker, further to the works at the RAN, we went ahead, Mr. Speaker, with the construction of a new 40-feet container-sized modular operating theater, pre-op and procedure room incorporated into the footprint of the RAN Memorial Hospital to meet the current service needs while awaiting the construction of a new replacement facility. And, Mr. Speaker, there's the construction of a new, fully commissioned 2,800 square feet infectious disease unit with 7 isolation spaces, which are to be used in response to the existing COVID-19 pandemic. We did all of that at the RAN, and more, and more, and more to come. Additionally, Mr. Speaker, we have demolished the administration and obstetrics and maternity wings at the RAN. And shortly, Mr. Speaker, there will be upgrades to the existing morgue area with an extension of the corridor to link to the accident and emergency services. Mr. Speaker, given this level of investment on the existing hospital site, honorable members and the general public are advised that there will be a structured redevelopment program of the RAN Memorial Hospital infrastructure. This plan will maximize Pine Ridge on-site redevelopment services. So these services, what we're looking at, will be able to address the health needs of Grand Bahama for the next 15 to 20 years. These improvements, Mr. Speaker, when we are done, will be able to address the health needs of the entire island of Grand Bahama for the next 15 to 20 years. A part of that, Mr. Speaker, that is coming, and we want the people of Grand Bahama to hear us. That is not just a tower for New Providence. Mr. Speaker, as with PMH, it gives me great pleasure to report that this Free National Movement government will commence the construction of a new 4-story level climate resilient hospital in Grand Bahama on the Rand Memorial site. Mr. Speaker, the Beck Group, the architectural and engineering firm, has devised these plans as well. Mr. Speaker, going forward, based on preliminary assessments, it is anticipated that the estimated cost to completely rebuild the Rand Memorial Hospital will be around some $35 million, including the cost of furniture, fixtures, architecturally significant equipment, and again, other IT-related costs. Mr. Speaker, very soon, the construction of the 4-level tower will allow for inpatient services to be removed from the ground floor level to the 2nd and 3rd floor stories of the new tower. In the event, Pine Ridge, of another major disaster, Mr. Speaker, healthcare services would not have to be displaced, as was the case after Hurricane Dorian. The new tower will have a minimum, Pine Ridge. I knew you said something along the lines of this in your contribution. The new tower will have a minimum of a 5-foot foundation height above grade. This will ensure, Mr. Speaker, non-flooding of the facility during the worst of hurricanes. This new tower would provide the opportunity for all services to be available in one facility in Grand Bahama at one point in time. Mr. Speaker, with the completion of these works, PHA will not have to pay the current rental fees of $1,025,916 annually. These fees are paid to house off-site clinical, administrative, and support services that are currently needed in the Grand Bahama health sector. So once we're done, we will move all of the healthcare services into the facilities at the Rand Memorial Hospital. Mr. Speaker, using some conventional construction methods and some new construction methods, my colleague, the Honorable Hiram Lewis, and I have spoke about some of these techniques. It is estimated that the Princess Margaret and Rand Memorial Hospital towers, Mr. Speaker, will be completed and ready for commissioning within 24 months or 2 years. Stay tuned, Pine Ridge. Mr. Speaker, all of these renovations and new construction will greatly enhance the bed space throughout our nation's health sector. In regards to healthcare bed space, Mr. Speaker, the Bahamas, I want to say this here, Mr. Speaker, the Bahamas is eternally grateful to Samaritan's Purse for providing an emergency field hospital at the Princess Margaret Hospital to meet the need during the 2nd wave of COVID-19 pandemic. Similar assistance was given by Samaritan's Purse during the restoration efforts in Grand Bahama near the Rand Memorial Hospital after Hurricane Dorian. Again, we say thank you to Samaritan's Purse for their Christian charity, Mr. Speaker. Mr. Speaker, we continue to be forward-leaning in our thinking. The next phase of hospital redevelopment will seek to exploit revenue opportunities as well. These opportunities will offset an investment in physical improvements of the facility by incorporating an approximately 20 to 25% of all bed spaces as private rooms within the PHA ambit. The Public Hospitals Authority intends to attract a ready market to service the operational costs and the repayment of the loan. With the addition of these private rooms, Mr. Speaker, this investment will increase revenue opportunities in these service areas of our healthcare delivery. So that is our plan, Mr. Speaker. Mr. Speaker, with such modern facilities, it is imperative to move to a more efficient business model. Consequently, PHA will move more towards offering market prices for medical services to those class of patients with the ability to pay. This is especially important when patients request private care through an insurer or via a self-pay mechanism. Mr. Speaker, that's PHA. I will now move, Mr. Speaker, to the infrastructural works at the Department of Public Health. Mr. Speaker, healthcare delivery service is split into three areas. There's primary care, you go to the doctor just for a visit, secondary care, and tertiary care. Mr. Speaker, the goal of the Department of Public Health since 2017, as was articulated by the former minister, Dr. Sands, has been to renovate, redesign, and expand primary healthcare facilities and services in New Providence and the Family Islands. The improved infrastructure would provide for improved safe delivery of primary healthcare services at our community clinic level. Mr. Speaker, to achieve this goal, attention was given to the renovation and redesign of 4 polyclinics, namely in New Providence: Elizabeth Estates, Flamingo Gardens, Fleming Street Clinics, and the South Beach Health Center. In 2019, the Cabinet authorized the renovation, redesign, and expansion of the Arnstown Elizabeth Estates Clinics and South Beach Health Center. Mr. Speaker, it should be noted that over $1 million of renovations have already now been completed at the South Beach Health Center to outfit it to receive and deliver services to those suspected of contracting COVID-19. And since the South Beach Health Center is currently being used as the COVID center, the expansion of this facility to a 24-hour primary and urgent care center has been deferred for the time being. And Mr. Speaker, it is noteworthy that during the height of COVID, the second wave, we were able to complete the construction. We started in the first wave, we were able to complete the construction of the South Beach Health Center to be able to address our circumstances in regards to COVID. Mr. Speaker, we remain focused. Renovations continue at the Arnstown and Elizabeth Estates clinics. The constructions of the Arnstown's clinic, Freetown, provides for the expansion of the gerontological clinic for senior citizens, tongue twister, that have complex aging and mental health issues. The clinic will also decentralize the adolescent mental health services from the PMH hospital down to the community level. Mr. Speaker, residents receiving regular maternal and child health services at Arnstown will also have access to basic primary healthcare services, inclusive of the refilling of medications, dressings, and follow-up of non-urgent healthcare needs at Arnstown's clinic. Mr. Speaker, we have heard the cries of our pregnant mothers again, and the need to have more maternity-friendly facilities. Therefore, it gives me great pleasure to advise all mothers that the health team in the Ministry of Health, our design teams, is producing a report that will catalyze the construction of a maternal and child health center in the area of the National Insurance Building on Blue Hill Road. Mr. Speaker, this means that the services from Blue Hill Road Clinic, Adolescent Health Center, Coconut Grove District, and the antenatal services at Fleming Street Clinic will all merge into this facility. In the coming weeks and months, more information will be released to the public outlining the future use of these other buildings for those services and population health initiative. Mr. Speaker, the government has identified the site, on Blue Hill Road where there's the National Insurance Building, and then there's BPL, BEC. In between, you see that there's a vacant space there, Mr. Speaker. We're looking at a modular design of going up, having a 2-story building that will fully address our adolescent child health mothers in that facility, Mr. Speaker. Stay tuned. Additionally, Mr. Speaker, staying in New Providence, the renovation, redesign, and expansion of the Elizabeth Estates clinics are also underway. The clinic will be equipped with a portable X-ray and other points of care equipment for improved management of persons presenting with urgent care needs. Funding has also been placed in the budget to address the renovations of the Flamingo Gardens and the Fleming Street clinics. Mr. Speaker, this government has always been of the people, for the people, and by the people. That is why our theme, Mr. Speaker, was "It is the people's time." Infrastructural development in healthcare, Mr. Speaker, will not stop here in New Providence and Grand Bahama. This government will also upgrade clinics in the family of islands, colleagues. Within the family islands, Mr. Speaker, the government has sourced a $60 million IDB loan. We will construct and/or retrofit 9 primary clinics in 7 islands. The physical works will fulfill 4 attributes that we deemed necessary in the healthcare environment. Those buildings will be resilient to disaster and climate change. They will be designed to care for and contain the spread of infectious diseases. They will be designed with the capacity for telemedicine services and the sustainability and energy efficient design to comply with what is known in the construction industry as EDGE, which is excellent design for greater efficiency. EDGE, Mr. Speaker, is a green building certification. Mr. Speaker, EDGE, the green building certification system, enables design teams and project owners to assess the most effective ways to incorporate energy and water-saving options in their buildings. EDGE is comprised of a web-based software application, a universal standard, and a certification system. Mr. Speaker, if you have a minimum prediction of 20% less water and embodied energy and materials, then your project can and does meet the EDGE standard. EDGE design buildings are currently saving 75,722 megawatt hours per year of energy globally. They are saving 1,800,700 cubic meters of water globally. They are saving some 320,554 gigajoules of energy in embodied energy around the world. Get a little bit into gigajoules, Mr. Speaker, but I want to finish this. And I want the people to understand. As Marco City said. Mr. Speaker, these 9 clinics, these new clinics that will meet the EDGE certification will be built on the following sites. Exuma, one will be built at Black Point. One will be built in Mangrove Key, Andros. Another in Fresh Creek, Andros. Andros. Another will be built, Brother Johnson in Rock Sound, Eleuthera. And another, the member for Cat Island, is in here in Smith's Bay Clinic, Cat Island. We ain't gonna leave it the way we met it. The renovations and/or expansions of clinics are also expected to occur in the following locations.
Tell us which ministry started it.
The Abaco,
Tell us which ministry.
Yeah, tell us which one.
Tell us which ministry to go to so we can finish it. Which ministry? Oh, you ain't getting into all of that. You wasn't there. You don't know. You don't know, so relax. Yeah, but let him tell us which ministry.
The Abaco.
Be careful with your support. Make sure you get your apology first before you defend them.
Oh, he hasn't gotten the
No,
apology.
he hasn't gotten the apology yet. Get your apology, then defend them.
Mr. Speaker, another will be built at the Abaco Primary Health Care Center. Soka isn't here, but Mr. Speaker, the Miriam Green Clinic in South Andros, the Bimini Clinic, and the Deadman's Key, Long Island Clinic. All this construction work, Mr. Speaker, has a ticketed cost of just under $20 million. Mr. Speaker, it is noteworthy to share with you a summary of the program that's part of this $20 million construction. Mr. Speaker, we have a prototype program that is designed to reduce morbidity and mortality in the country due to COVID-19 or future pathogens. How will this be achieved, Mr. Speaker? There will be another $20 million where we will ensure that 17 clinics in the Family Islands receive air conditioning works to install negative pressure units outfitted with ultraviolet light capacity and return air systems and MERV 20 ventilation filtration in the air handlers. Builders, architectural and construction works are all included. And Mr. Speaker, what we intend to do, just to break it down a little bit for the Bahamian people, what I would have described as an HVAC system is one that is used in laboratories where you deal with the most dangerous infectious pathogens. You have a negative pressure where air is being sucked out of the building. We're not pushing air down and keeping that air in the building. The air is being pulled out. The air passes over ultraviolet filters. Mr. Speaker, it is a known fact that ultraviolet light destroys the DNAs of viruses and bacteria. And Mr. Speaker, the very pathogens themselves are going to be blocked from coming back into the space with MERV 20 filters that actually are capable of filtering viruses and bacteria. Mr. Speaker, the clinics that are going to experience this will be Elizabeth Estate Clinic, Flamingo Gardens Clinic, Fleming Street Clinic, South Beach Health Center, the Exuma Primary Health Care, Georgetown, Abaco Primary Health Care, Cooperstown, Miriam Green, Nicholstown, Spanish Wells, Harbor Island, Lower Bogue, Governor's Harbor, Wims's Bight, Inagua Community Clinic, Bimini Community Clinic, and Coburn Town Community Clinic. The other 9 clinics, Mr. Speaker, that was spoken about with the 20 million, they are also a part of this. They will be receiving the exact same systems within the family of islands. Mr. Speaker, additionally, 24 ports and seaports will also receive upgrades in infrastructure to accommodate isolation units for health emergencies as well. These initiatives, Mr. Speaker, will serve to ensure worker safety and patient safety. So what we intend to do, at 24 of our seaports where our tourists are coming in, Mr. Speaker, we are going to construct where our medical bays are, Mr. Speaker, the kind of room that is able to deal with an infectious disease potential introduction into the Bahamas so that we can hold it there on that site and reduce the opportunity for that potential infectious pathogen being introduced into the Bahamian community at 24 seaports. Mr. Speaker, we will do that over this upcoming fiscal period.
Come back home.
Mr. Speaker, the Prime Minister is inviting, eh? Mr. Speaker, it gets better. An additional 20 million in IDB funding will support the following initiatives. First, with 8 million, we will improve the delivery of care model by reorganizing and standardizing the provision of primary and hospital care services provided by NHIA, the Department of Public Health, and PHA, and by implementing a person and a community care center model for health. Secondly, Mr. Speaker, in addition to the construction details that I've already provided, we will enhance the capacity to provide primary care by upgrading medical equipment throughout the country. I want to say that again, because many in the health sector has been asking me since I assumed the portfolio about this, and I want them to know that a part of this funding will be the capacity for us to provide primary care by upgrading medical equipment throughout the country. That equipment will be defibrillators, portable x-ray machines, ultrasounds, electrocardiogram, and equipment for laboratory tests, dental service, and preventative care. And Mr. Speaker, a part of this funding, Long Island, a part of this funding is to procure 6 ambulances for those facilities in our family of islands. Long Island, home to my ancestors and yours, Adrian, the promise made for your ambulance will be kept. It will be delivered because we in the Free National Movement, we deliver. Mr. Speaker, thirdly, with 10 million, we will modernize the health information system, the IT system in regards to health throughout the country. This modernization will address the integration of existing and new applications and equipment such as laboratory, pharmacy, and diagnostic imaging applications into the new electronic health record system and allow for health information exchange among and in 54 clinics of the Department of Public Health throughout the entire country. Mr. Speaker, there are 96 clinics in the Department of Public Health throughout the Bahamas. 96 in 56 population centers. We will be addressing the IT system in the 54 major ones. We will have, and in addition to that, Mr. Speaker, we're going to achieve that. We will have one medical record system for all healthcare service in this country. Mr. Speaker, there is only one country on the globe currently that has one medical EHR system, electronic health record system for all its citizens. That nation, Mr. Speaker, happens to be the State of Israel. I can now announce to the Bahamian people that the second nation on earth to do so will be the Commonwealth of the Bahamas. As the Prime Minister has pointed out, that is a part of the digital revolution that we have promised the Bahamian people. Yes, Mr. Speaker, we are bouncing back. And yes, Mr. Speaker, we are rebounding in this country.
You voting against that?
Mr. Speaker, I ain't done yet with infrastructure. Going back, I gotta go to a couple of islands. Mr. Speaker, on the 27th of April, 2021, as a part of the IDB project, the Ministry of Health hosted a virtual public consultation with the residents of Deadman's Key, Long Island, to discuss the renovation, redesign, and expansion of the David Sims Memorial Health Center in Deadman's Key. This is the first of the consultations that will take place with all of the family island communities that will have a new or renovated clinic under the IDB program during this fiscal year. This consultation, Mr. Speaker, is required as a part of the IDB funding. And we started in Long Island. I was accused of being somewhat deferential to Long Island because it is the land of my ancestors, but I had to say that Long Island put all of their ducks in a row long before the funding came into place. Eleuthera is very near and close to doing so.
Hometown boy. Oh, yeah.
Mr. Speaker, I warned the member for Long Island.
All the stuff he say for you.
I warned the member also for Long Island and the people of Sims not to worry,
3-0.
because Long Island, we got you. And we will not be leaving you, the clinic in Sims, out. Mr. Speaker, funding has been placed in this budget to provide for the expansion and redesign of the clinic space to ensure the provision of high, safe, quality healthcare service in Sims, Long Island as well. I'm sure, my brother, you will continue to inform our people. You'll continue to inform our people in Long Island. That's Long Island. Mr. Speaker, COVID-19 and the effects of Hurricane Dorian did not. We can make a little track around the family of islands now, Mr. Speaker. We started with Long Island. Mr. Speaker, COVID-19 and the effects of Hurricane Dorian did not permit some of our planned projects to commence as anticipated on the island of Abaco. Just as the song says, Mr. Speaker, lean on me when you're not strong, and I'll be your friend. I'll help you carry on. The non-governmental organizations Direct Relief and its partners permitted this administration to lean on them and on their shoulders. Direct Relief and its partners brought to birth several projects to repair and redesign and restore healthcare facilities on the island of Abaco at no cost to the government of the Bahamas. Among the projects executed by Direct Relief is a 6-unit staff accommodation complex located on the grounds of the Abaco Primary Care Center that will be completed and occupied by the end of July 2021. 2 new generators have also been purchased for those facilities. And Mr. Speaker, I want to announce to the Bahamian people that every health facility in Abaco, now either through non-governmental organizations or by direct introduction of the government of the Bahamas out of the Consolidated Fund, we have installed standby generators at every health facility throughout Abaco. Mr. Speaker, Direct Relief, in collaboration with the University of Miami, is constructing a 5-unit building near the existing staff accommodation in Marsh Harbor. And clinic and staff accommodations are also being constructed on Guanakee and Manawakee. These constructions, Mr. Speaker, will be completed by year's end, December. Mr. Speaker, they say a friend is worth more than riches. This administration, so true, so good. This administration has seen this statement proven true over and over again. The NGOs, AmeriCares, and Clinic in a Can teamed up with the government to provide a modular clinic for Hard Bargain Moors Island. Mr. Speaker, the government, this Free National Movement government, has provided the land, and to meet building code requirements, the government is responsible for the construction of the foundation and the utility service tie-ins to this clinic in a can to the tune of some $120,000 that the Cabinet of the Bahamas has approved to be able to put this clinic into Hard Bargain Moors Island. This project, Mr. Speaker, will be completed by the end of August this year, so the people of Moors Island will have themselves a clinic in a can. Mr. Speaker, I take this opportunity to convey our heartfelt appreciation and thanks to the non-governmental organizations who have stuck with the Bahamas through thick and thin, so that we are able to see the light at the end of this proverbial tunnel. Mr. Speaker, despite our setbacks, renovations and repairs are taking place at the doctors and nurses' residence in Cooperstown, Abaco. The Department of Public Health will continue to pursue repairs in Abaco clinics at Cooperstown, Foxtown, and Green Turtle Key. Abaco, we got you. That's Abaco. Mr. Speaker, we now turn our attention to the southeastern and central Bahamas. It is anticipated that 2 state-of-the-art facilities currently under renovation and equipped with telemedicine capabilities with portable X-ray and point of care laboratory equipment will be completed in Auckland by the end of this September this year, in 3 short 4 months. Mr. Speaker, this time around, Crooked Island is poised to experience the redesign and expansion of the Landrell Point Clinic in this budget. It is expected, Mr. Speaker, that this would strengthen the management of acute and non-acute and infectious diseases with negative air pressure rooms, again, on the island of Crooked Island. Mr. Speaker, we move to Megwana. Additionally, activities to reactivate the repairs and expansion of the Abrahams Bay Clinic in Megwana will begin, Mr. Speaker, next month in July in the new fiscal period. Mr. Speaker, to Megwanians, we got you. And, Mr. Speaker, your request, Megwanians, for a doctor, we will be sending you a doctor to be with you in Piratesville very, very soon. Further, Mr. Speaker, during this fiscal year, funding will be provided in a phased approach for the ongoing renovations and repairs of the staff accommodations at your hometown, Mr. Speaker, of Inagua, at the Inagua Healthcare Center. And those works are to be completed by the end of the fiscal year, this next fiscal year, June 2022. Mr. Speaker, we're not done yet. Mr. Speaker, we now move to Exuma. You know, we told Black Point Exuma that they were going to have a newly constructed clinic under the IDB project. Well, I don't want you to believe that we are curry favoring Black Point among the Exuma Keys, but you know I love that place. Mr. Speaker, I would just ask the Black Point community to bear with us as we identify the property for their new clinic in Black Point. That has already been earmarked for construction in this new 2021-2022 budget. In the meantime, we will be relocating the present clinic to a more suitable building that is compliant with existing and proper health standards. Mr. Speaker, these clinics will keep you busy, as you could see. Along with COVID, Mr. Speaker, these clinics and construction works have certainly been keeping me extremely busy. Right now, Mr. Speaker, assessments are being carried out at the Exuma Primary Health Care Center to execute urgent repairs to the air conditioning and plumbing. Plans are in place to treat the state-of-the-art center HVAC system for rust, to modify the design to prevent further corrosion of the air conditioning due to the salt air and lack of negative air pressure rooms, ultraviolet light, and medical-grade ventilation air filters. Mr. Speaker, I had an opportunity to look at the design for the Exuma Healthcare Center, and I can truly say that, well, let me not say that. As the designer myself, it left a lot to be desired, but we are fixing it, and we will fix it. Mr. Speaker, my ministry assures the staff of Exuma Primary Health Care Center and the people of Exuma, and the people of Exuma,
You're welcome.
and the people of Exuma, that steps are being taken to ensure preventative maintenance of this facility is sustained with regular maintenance contracts going forward. In addition, human resources to provide specialist and diagnostic services are also being realized for Exuma to complement the growing share of the population Exuma now occupies as a result of the growing tourism sector on that island. Mr. Speaker, I'm not done yet. We're still in the constituency of Exuma. There's more. Notably, the clinic in Ragged Island is being executed by the Ministry of Works. The Ministry of Health and the Department of Public Health continues to offer support and guidance in the design of this building. That will be a smart, green facility. We are hopeful that the construction of this new facility will be realized also by the end of this fiscal year. This facility will aid in helping Ragged Island to achieve what Doc, the Prime Minister, declared with his declared intent to make Ragged Island a green island. The clinic will also service the Royal Bahamas Defense Force Base resident at Gunpoint. That's Exuma and Ragged Island.
You won't be there. As a private
I can reiterate to you what Doc said, eh? Exoma, you ain't gonna be there. Mr. Speaker, we now move to Cat Island. Member for Cat Island is in here. We have not forgotten the people of Cat Island. We will also execute plan repairs for the temporary Orange Creek Clinic and the Old Bike Clinic in Cat Island.
Let's hide.
These repairs will commence before the end of July 2021. Next month, Cat Island constructions will start. In addition, Mr. Speaker, we had said earlier with the IDB funding, I want the people of Cat Island to know that we will be constructing a new clinic in Smiths Bay, Cat Island. And Mr. Speaker, that construction will start in this new fiscal period. North Andros and the Berries. North Andros and the Berries. Moving further.
Tell us which ministry to go to finish it.
Moving further north to the Berry Islands, the architectural drawings for the Berry Islands Clinic have been completed and approved.
Tell us which ministry.
Plans are now underway to facilitate a contract for the renovation and redesign of a rental building to facilitate the Berry Islands Clinic.
We can't find
The
it.
current challenge right now is to identify land to house the new clinic. In the meantime, clinical services will be relocated to an improved environment for healthcare workers and clients.
We can't find Cat Island.
Mr. Speaker,
No ministry.
we can't forget Andros. Andros, oh my Andros. In the north, in Mastic Point, Andros, renovations of the old doctors and nurses residence and the Red Base Clinic will all commence in August of this year. And Mr. Speaker, again, as a part of the IDB program, Mr. Speaker, we will have a new clinic built in Central, in Fresh Creek. There will be a new clinic built. As well, Soka, as well,
Listen up.
there will be a new clinic constructed in Mangrove Key as a part of the IDB program, right across the bay from my home and yours. Right across from Drakesville. Oh, Drakesville, I love the place. Land of my ancestors.
What on now?
Mr. Speaker, we're moving around. Mr. Speaker, we now move to the sunny, windswept island of Eleuthera. Eleutherians can look forward to the following projects during this fiscal period. The phase 2 repairs to Spanish Wells and the Harbor Island clinics. Eleuthera now has a newly renovated Bluff Clinic. And I want to thank my colleague, the MP for North Eleuthera, Ricky Markey, who has spearheaded this renovation. And Mr. Speaker, that is a beautiful edifice that has been constructed. And with scheduling, the Prime Minister and I will open this clinic at the end of July or soon thereafter, once we would have procured all of the medical equipment to be housed in that space. Mr. Speaker, there's going to be a redesign and repair of the Lower Bowl Clinic and residence. Mr. Speaker, phase 1 repairs and renovations will take place at the Old Governor's Harbor Clinic and residence. Mr. Speaker, we are also beginning the construction, again, under the IDB's program, the construction of a state-of-the-art facility on mainland Eleuthera in the Rock Sound area under the IDB's program. Mr. Speaker, here's a national health fact. The island of Eleuthera has a total of 16 clinics. 16, which accounts for 17% of all primary health care facilities or clinic services in the country. What is disconcerting, Mr. Speaker, is the fact that 7 or 44% out of the 16 clinics on the island of Eleuthera, especially mainland Eleuthera, they currently do not meet the healthcare standards in law. Assessments show that they can only provide basic care, and unless there's a massive injection of capital, they will never meet the licensing standards. Mr. Speaker, consequently, plans are underway between the central and local executive management teams in South Eleuthera to strengthen the provision of home care services. Later in the year, a healthcare conclave or workshop will be held with the Ministry of Health and the community to determine the best way forward. We will discuss the access to healthcare services on the island, the construction of the new facilities that are coming, and the extended hours of the clinical operations. Mr. Speaker, we will not leave Eleuthera in that state. Mr. Speaker, the built environment throughout the Bahamas will be busy in this coming budget period. Mr. Speaker, I now move from infrastructure to another area that the Prime Minister has asked me to address and to see the management of. Mr. Speaker, the second area of focus to support the healthcare system is the adoption and expansion of telemedicine to improve access to healthcare. Mr. Speaker, for those Bahamians who are not familiar with this term, telemedicine is the practice of medicines that use technology to deliver care at a distance. In such instances, a physician in one location using some form of telecommunication device or infrastructure, mostly via the internet, to deliver care, advise, and prescribe medication to a patient or treatment in another distant location. Mr. Speaker, the interactive model of primary and public health care requires that urgent and intermediate recruitment, employment, and deployment of trained, experienced health services, administrators, laboratory technicians, radiographers, X-ray technicians, pharmacists, pharmacy technicians, biomedical engineers, and technicians, nutritionists, and health educators, psychologists, physiotherapists, and community health persons be reorganized in the primary healthcare system. Mr. Speaker, I would have spoken to this last night when I said that the government in its tertiary institution is looking to expand to develop an allied health professional program to address all of these professions within the healthcare system to make sure that we have the requisite personnel throughout our family of islands, Mr. Speaker. Mr. Speaker, it is coming. What is noteworthy, Mr. Speaker, is that 60% of persons referred from the family islands to the hospital in New Providence could have received care on their own island if there was a trained allied health worker to operate the X-ray machine, expand diagnostic testing at the point of care, and know how to access an electronic medical record. Before the construction of the Abaco and Exuma primary healthcare centers, meetings were held with specialist physicians to determine how best to bring the safe provisions of specialist services to the people of Abaco, Exuma, and the southeastern and central Bahamas. The answer, Mr. Speaker, was via direct or site visits, posting of the skill sets on the ground, and, Mr. Speaker, and by telemedicine. Mr. Speaker, the Bahamas is an archipelago in various stages of development. Many patients from the family islands have nowhere to stay if they are transported to New Providence or Grand Bahama. Sometimes they have to rely on the kindness of relatives or friends. Mr. Speaker, interestingly, many pregnant women in a survey in 2016 advised that 50% of their maternity leave, 50% of their maternity leave was already exhausted before they even had their babies. This is because they traveled to New Providence to have their babies in a hospital here. Mr. Speaker, if we are unable to have consistent direct doctor visits or the luxury of posting skill sets on the ground, then telemedicine is the solution to our archipelagic challenge. With this in mind, Mr. Speaker, some $2 million will be allocated for the telemedicine initiative as instructed by the Honorable Prime Minister. This initiative will expand to provide specialist care throughout the family islands. Mr. Speaker, telemedicine will permit the patient in Andros, Abaco, Exuma to receive medical attention without having to take a flight over to New Providence to receive good and adequate health care. Mr. Speaker, there's so much we can do with telemedicine at our state-of-the-art healthcare centers in some of our family islands. The infrastructure is already in place to bring this telemedicine project to completion. Plans have already been made to reestablish telemedicine in Andros and Abaco. It will further be expanded to Exuma Inagua, and Long Island. Using a phased approach, telemedicine will be expanded to all other family islands in the Bahamas by the end of this fiscal period. Mr. Speaker, I wish to pause here for a moment to bring to light something that the Bahamian people need to know. When the FMLN government left office in 2012, telemedicine was alive and well in Andros and Abaco, having been spearheaded by Doc, our Prime Minister. When my health team called the Public Hospital Authority recently to find out if they were implementing telemedicine, the team was informed that telemedicine had been dismantled by the former administration. The same thing applied to telemedicine in Andros and Abaco. This was preposterous. How could a government bring itself to a point to dismantle such a service that will give Bahamians access to the best of cost-effective health care throughout our family islands? The former administration should cry shame, Mr. Speaker, for not keeping this practical arrangement. Unfortunately, the Bahamian people has borne the brunt of that foolhardy decision, which served to limit their access to the best of health care. But Mr. Speaker, we will reintroduce telemedicine. Mr. Speaker, it was articulated to me that places like the Exuma Healthcare Center, always intended to provide access to advanced primary health care, primary specialists, and population service for the southeastern Bahamas and the central Bahamas, Mr. Speaker. And, Mr. Speaker, we will do it. Mr. Speaker, I understand that this would reduce unnecessary referrals to Princess Margaret Hospital and the Ryan Hospital for persons with non-acute access requiring admissions for 48 hours or less, and yes, it will reduce the air ambulance bill. Health planners estimate that strengthening such services could reduce the healthcare costs by more than $2.5 million annually. Not to mention the reduction in direct costs to the Bahamian people residents in the family islands. And as has been said by North Abaco, money is no impediment when it comes to saving the Bahamian people's lives. Mr. Speaker, let me be the first to tell you that from now on, telemedicine will be made a part of our healthcare facilities throughout. Readily available to the Bahamians wanting to access them. We in the Free National Movement, Mr. Speaker, is known for delivering, and Mr. Speaker, we will deliver on this because it is the people's time. Mr. Speaker, I now move to a hidden jewel, a real success story within the Ministry of Health. This jewel, Mr. Speaker, is none other than the third area of focus given to me by the Prime Minister, which is to support the healthcare system, the Bahamas' journey towards universal health coverage through the National Health Insurance Authority. Mr. Speaker, the National Health Insurance Authority continues to expand access and progress towards universal health coverage for all Bahamians and legal residents in our archipelago. Mr. Speaker, in early 2017, after the passage of the NHI legislation, in the first 2 months, there were some 20,000 persons who signed up for primary health care services. And Mr. Speaker, this is the plan for the introduction of universal health coverage. In 2017, the law was passed. There was 20,000 beneficiaries added to the plan. On our journey to universal and high-cost care, we realized, though, Mr. Speaker, there had to be an intermediate step, which is the primary care transformation initiative that I will speak to. Mr. Speaker, NHI realized that before we could move to universal health coverage, there needed to be an intermediate step. which is now called the Primary Care Transformation Initiative. In pursuit of the Primary Care Transformation Initiative, the National Health Insurance Authority assessed the current state of primary care delivery service to the Bahamian people. And here is what was found with the primary health care services in the Bahamas as it currently stands in the Department of Public Health and within the private sector. Mr. Speaker, right now a patient accessing primary health care services has 5 avenues that he or she can receive primary health care: the National Health Insurance, the Department of Public Health, the Public Hospital Authority, private insurance, or just out of pocket at a private doctor's office. This is the current state in the country for primary health care services, and there's no interlink in those 5 avenues. This was our problem. For primary health care delivery. Mr. Speaker, recognizing the challenges to the delivery of primary care, the following solution was proposed and is currently about to be implemented through the PCTI initiative in this coming budget period. The solution, Mr. Speaker, is that the 5-track process is now being reduced to a 2-track process where all patients, all Bahamians within the country would be able to either have primary care services delivered through the National Health Insurance or by private insurance, who will all have one standard benefit package agreed to. Mr. Speaker, the current standard benefit package of NHIA is that you can see a doctor as many times as you want for those who have signed up with NHIA in the primary healthcare environment. All lab tests, blood tests are a part of that. And the PCTI initiative will add diagnostic imaging, mammography, digital imaging, cancer screening, x-rays, and colonoscopy. Mr. Speaker, with solution in hand and focus action by NHIA Chair Dr. Robin Roberts and the newly hired Bahamian Managing Director Christy Butler, who has taken over and succeeds Canadian Managing Director Graham Whitmarsh, the program has mushroomed. Currently, more than 160,000 Bahamians have access to services delivered through a network of over 100 positions, or 45% of all eligible primary care physicians in the country. Mr. Speaker, that is truly a success story. Again, Mr. Speaker, 45% of all primary health care physicians are in our PCTI program. And Mr. Speaker, just to give you an idea of what has been taking place within the National Health Insurance Authority, this has been the growth. Mr. Speaker, at the beginning of our last fiscal period, well, in 2017, there were 20,000 persons a part of NHIA. There was a target of having to reach 105,000 by June of this year. Mr. Speaker, we met that target in May of this year. Mr. Speaker, it is anticipated by the end of this fiscal period, next year, June, there'll be some 153,227 behaviors inside the program receiving primary care. Mr. Speaker, you can see that as more persons are actually being added, the cost, the capitated cost, is actually going down. Mr. Speaker, NHIA had asked the government of the Bahamas for an additional $12 million in this budget, Mr. Speaker, to achieve what we have put forward there, Mr. Speaker. We have given them $7 million. So, Mr. Speaker, we know, given the growth in NHIA, that we're probably going to have more than the 153,000 persons added to the roll by the end of June. And Mr. Speaker, June of next year, despite the COVID-19 pandemic, during this fiscal year, Mr. Speaker, NHIA experienced a 40% rise in employment from 70,000 beneficiaries in 2019 to over 105,000. Mr. Speaker, our 100th beneficiary who joined our program is 8-year-old Craig Anthony Sherman Jr. He's the 100,000th beneficiary who joined our program. He was enrolled by his father, who wanted to ensure his young son had access to affordable and quality primary health care. It is noteworthy to mention that when surveyed, 96% of NHIA beneficiaries advised that they were satisfied with the services received and look forward to the expansion of the additional benefits offerings. The performance indicator helps us to see that an accelerated Bahamas, Mr. Speaker, is supported and underway. Additionally, NHIA payments to healthcare providers and laboratories total some $2 million each month. This accounts for some 86% of the NHIA's total cost. To put it another way, just 14% of the monies allocated to NHIA is used for administrative costs, ensuring that the bulk of the expenditure is utilized to provide access to primary care for the Bahamian people. Notably, Mr. Speaker, NHIA successfully launched the electronic health record in November of 2019. Currently, there are 100 physicians and 92,000 beneficiaries on our electronic health record platform that we are now deploying and will deploy in every health sector so that we achieve that one medical health record for all in country. They can sign up at NHIA, the National Health Insurance Authority, which is located on East Street. Mr. Speaker, the telehealth functionality of the electronic health record has activated to increase access to care throughout our archipelago and reduce inequalities. Mr. Speaker, I spoken to earlier in this feature the address of the geographical challenges faced by beneficiaries who live on the family islands or who have physical challenges getting to their physician's office. The Primary Care Transformation Initiative was launched by NHIA last year, 2020, and provides all Bahamians and legal residents with a single universal primary care electronic health record. Again, Mr. Speaker, we will be the second nation to deploy such a system. Mr. Speaker, the initiative is designed to integrate public and private primary care delivery models within the country and to remove duplications and silos of non-integrated health sector. The initiative will also play a significant role in managing healthcare costs in the Bahamas and establish a national network of primary care providers contracted Exuma on a per capita basis. Mr. Speaker, the initiative permits all Bahamians access to a primary care provider without co-pays or deductibles. Now, Mr. Speaker, do you see the evidence of our accelerated Bahamas plan, Pine Ridge? At the end of the day, Mr. Speaker, the burden of the public hospital will shift with more emphasis on primary care. With the integration of the public clinics and NHIA, we expect to see annual operational efficiencies throughout the entire healthcare sector. Mr. Speaker, it is already projected that by the year 2025, 4 short years, operating expenditure for primary healthcare will have been reduced by some $16 million, and health systems costs in the country are projected to be reduced by some $55 million. With these cost savings and no additional taxation, we can shunt more funding to healthcare areas with greater demand. This allows the government to move more seamlessly to our next stage of NHIA, that of universal health coverage. Mr. Speaker, I have another 30 minutes after. Good. Mr. Speaker, I move to the fourth area of focus to support the healthcare system, and that is the mitigation of COVID-19 and vaccinations. Mr. Speaker, before 2019, COVID-19 was not found in our vocabulary. Now it is a household term. Recognizing that COVID-19 is not going to go away entirely or in the immediate future, the government must prepare itself for what could be and what must and what potentially lies ahead. Consequently, Mr. Speaker, $10 million has been allocated in this upcoming fiscal budget for COVID-19 contingencies. Mr. Speaker, precious little countries have escaped the wrath of COVID-19. The Bahamas has not been one of them. As at the 14th of June, 2021, a total of some 12,202 COVID-19 cases have been recorded, and for the most part are distributed along the population density profile of the country. There are 728 active cases of COVID-19 in country today. 104 cases were recorded during our nation's first wave. During the second wave, which spanned from July 2020 to January of 2021, an 8-month period, some 8,604 new cases were recorded. Thus far, Mr. Speaker, in the third wave, we've recorded some 3,494 additional new cases, which have contributed to our overall national COVID statistics. Mr. Speaker, I implore Bahamians not to listen to the noise in the market ranting that this government has no plan. Our plan, Mr. Speaker, is bearing fruit. For the fourth consecutive week, Mr. Speaker, our national incident on new cases have been trending down. We moved swiftly, early, to halt, arrest, nip the rise of cases in Abaco, Andros, and Bimini. Now, these islands have sustained low reporting numbers. Only 2 for Abaco, 2 new cases for Andros, and 3 for Bimini over the last 7 days. During the same time frame, Exuma has recorded 4 new cases and Grand Bahama 17. All other islands, Eleuthera, Inagua, Long Island, Cat Island, Auckland, Crooked Island, Maguana, and San Salvador have not had one single new case of COVID in the last 7 days. There's more good news, demonstrating the effectiveness of our plan. The national moving average is trending down since late May 2021. Hospitalizations, Mr. Speaker, are trending down. The highest COVID-19 hospitalization during the third wave was recorded at 58 persons on the 12th of May 2021. Since that time, the average COVID-19 hospitalization rate has moved to 53, then to 45, and now sits at 38 persons in the entire country. To bring home this point, COVID-19 bed occupancy rates are on the decline in every single COVID-19 care facility. Just a few months ago, I shared in this honorable place that 3 of these facilities were under significant pressure and was almost at capacity. Today, the picture is better. Bed occupancy rates as of yesterday at Princess Margaret Hospital is 57.9%. At Doctors Hospital West is 31%, and at South Beach Health Center is 30%, and in Grand Bahama, it is 8.7%. There are a total of 4 persons in the entire country receiving ICU level care for their COVID-19 care. Mr. Speaker, also the positivity rate is trending downward, currently sitting at 9%, from a high in the third wave of 16%. a 43.5% reduction in the positivity rate. Mr. Speaker, Mr. Speaker, some 102,475 real-time PCR tests have been performed since the first wave. I remind colleagues that the national policy on testing for COVID-19 has not changed. Any person presenting to our public health institutions with symptoms suggestive of COVID-19 will be swabbed at no direct cost to him or her. Again, I say, don't believe in the noise in the marketplace, Mr. Speaker. Dogs don't bark at parked cars. And this vehicle of the Free National Movement is certainly moving, and we can hear them bark. Mr. Speaker, the proverbial light at the end of the tunnel is peeking through, entreating us, compelling us to come closer. To do that, to maintain the downturn in these trends and to shorten the time to experience the brilliance of that delivered light, we need every Bahamian to come alongside us to rein in the epidemic and to emerge stronger as a nation. Mr. Speaker, this is never an easy topic here, but deaths due to COVID-19 remains a reality. The country recorded some 239 COVID-19 deaths. There are 28 deaths under investigation, which are not reflected in the above statistics. The role played by SARS-CoV-2 variants remain unsettled as we again await the results of our genomic sequencing from external laboratories. The literature, however, documents that variants of concerns and variants of high concern appear to spread more easily than other variants, which may lead to more cases of COVID-19. The World Health Organization on the 11th of March, 2021, reclassified B.1.617.2 variant from a variant of interest to a variant of concern. This B.1.617.2 variant is now known as the Delta variant. It originated in India and joins the other 4 variants of concern: the UK or Alpha variant, the South African or Beta variant, the Indian or Kappa variant, also known as B.1.617.1, and the Brazilian or Gamma variant. Mr. Speaker, we know that this new Delta variant is purported to be much more virulent. It is much more easily transmitted. But Mr. Speaker, here's a fact that we also know. Mr. Speaker, the vaccine currently available on the market are still effective against all of these variants.
Tell the people to get vaccinated.
Mr. Speaker, the introduction of variants into the community has resulted in surges in COVID-19 cases, straining healthcare resources with more hospitalization and potentially more deaths. Vaccination provides a path forward. Mr. Speaker, although we note that almost equal distribution of COVID-19 cases are among male and females, there is continued shift of the burden of disease to those 20 to 49 years. Within this group, the greatest rate of increase has been among the 25 to 34-year-olds. I want to say that again. Within the 20 to 49 group, which is accounting for the vast majority of the burden of our disease in our third wave. Within that group, the greatest rate of increase has been among the 25 to 34-year-olds. SARS-CoV-2, the virus that causes COVID-19, is a social creature that thrives, multiplies, and spreads when we get it. If you want to party, vaccinate. If you want to hang with the crew, vaccinate. Mr. Speaker, I've been saying that I got mine, you get yours, get vaccinated. Mr. Speaker, I am fully vaccinated.
right next to Exuma.
Mr. Speaker, it is worthwhile to remind us all that SARS-CoV-2 is an invisible nemesis. You can't see it on surfaces you touch. You can't hear it as it rides the sound waves of the air. And many cannot feel it as it occupies and invades their bodies, as the vast majority of COVID-19 cases are asymptomatic for the disease. So all the public health measures cannot be abandoned. Through all of this, Mr. Speaker, public health measures cannot be abandoned or discarded. We are too close to experiencing the brilliance of that light exposed in our COVID-19 mitigation plan that we have deployed. Mr. Speaker, I'm going to briefly go through some snapshots of that plan, just to reiterate.
To show that we have a plan.
To show that we have one, eh? Mr. Speaker, we would never be able to detect the presence of COVID-19 in our midst without sound laboratory services. Laboratory capacity for surveillance and diagnostic of public health threats has been significantly expanded in the country during the COVID-19 pandemic. At the beginning of the first wave, the National Reference Lab was successful with the assistance of PAHO at obtaining the required equipment and reagents for in-country molecular testing for SARS-CoV-2 virus. This served us well, with early diagnostics of the first cases early in March, at a time when many countries in the region were struggling to obtain similar testing capabilities. The Bahamas had achieved the testing capabilities. Mr. Speaker, since that time, testing platforms and modalities have expanded in the public and private sectors, with the availability of multiple molecular platforms in the public sector, inclusive of a gene expert testing platform, a Panther testing platform, the BioFire testing platform, alongside the nucleic acid amplification technology available at the National Reference Lab, which was purchased by us in September of last year. The introduction of the use of the World Health Organization approved ST biosensor and Abbott rapid antigen test was also guided by our national testing protocol and has also expanded the testing capabilities in country. Mr. Speaker, the Gene Expert, Panther, and BioFire platforms in particular have expanded diagnostic testing capabilities for several other infectious agents of interest to public health. So it's not just SARS-CoV-2. Infectious agents such as tuberculosis, the human papillomavirus, with syndromic infection diseases diagnostics available on selected platforms. Mr. Speaker, the pandemic, though unwelcome, has served us well in this regard to push us to receive and to modernize our testing platforms in country. Mr. Speaker, after a person has learned that he has COVID-19, contact tracing is most important to ensure that the disease is not spread to others in the community. As COVID-19 evolved, the Ministry of Health retooled its approaches and modalities. A contact tracing strike force was activated in early August of last year as the country began its encounter with the second wave of COVID-19. I am most pleased to report that some 220 Bahamians have participated in and received certification for the Johns Hopkins online contact tracing course, which was adapted to the local contacts by our partners at the University of the Bahamas. Mr. Speaker, throughout the second wave, almost 250 volunteers assist with contact tracing. Though some were reassigned from within the Ministry of Health, the vast majority were volunteers. Specifically, some 137 contact tracing volunteers from non-health sectors, such as academia, NHIA, Bahamas Air, Ministry of Tourism, the Public Service, and civil society volunteers joined us. Although nurses on the Family Island performed contact tracing duties, their work was augmented by volunteers, Mr. Speaker, on Grand Bahama, Eleuthera, and Exuma. To date, Mr. Speaker, some 12,202 cases have been contacted. I want to say that again, Mr. Speaker. To date, all 12,202 cases of COVID in this country has been contacted. Hundreds of clusters have been identified, and over 20,000 contacts of cases have been engaged by the contact tracing team. This quantification reminds us all that contact tracing was and remains a mammoth task. In early August 2020, before a critical mass of contact tracers has been secured, the time between a positive RT-PCR test notification and the first call from a contact tracer was longer than desired. From then to now, the interval has been steadily decreasing. The interval to the first call was on average 48 hours or less. However, contact tracing requires more support. When our health team reaches out to you, please be forthcoming with the necessary information. This is to help you and me get back to a sense of normalcy. We simply ask that you be courteous, as the health team are working hard to assist everyone in need. Mr. Speaker, without effective and timely contact tracing, we as a people would have always been chasing behind COVID-19. With our ever-increasing move to fully reopen the economy, fewer and fewer volunteers are available to augment the core surveillance team. I tip my hat to the extraordinary effort that this team, which currently is smaller in number, continues to display under the greatest test. To arrest COVID-19, Mr. Speaker, we cannot relax. We cannot become complacent. We cannot let up. Mr. Speaker, I am pleased to advise that the clarion call for the expansion of contact tracers, not just for COVID-19 crisis, but for the assistance with this essential component of our public health infectious disease threats, such as HIV, STIs, tuberculosis, vector and foodborne illnesses, and other such infections, is not going unanswered. Contact tracers are being trained and onboarded for the establishment of a contact tracing strike force within the disease surveillance unit. We will have a permanent strike force surveillance unit, contact tracers of some nearly 40 persons. 40, Mr. Speaker. We had 5 at the beginning of the start of this pandemic. So we will have 40 going forward in future to be able to address any potential pathogen exposures or introduction of new pathogens into our community space. To accommodate this expanded team, Mr. Speaker, and a dedicated space for the Health Emergency Operating Center, to accommodate these new individuals, Mr. Speaker, the Ministry of Health has entered into a contractual arrangement to rent a 2,704 square feet facility to accommodate this essential grouping. This arrangement is expected to be fully in effect by the first quarter of this new coming fiscal budget. Mr. Speaker, the director of the World Health Organization admonishes countries that during the pandemic, the fight against COVID-19 would require 6 essential components. One of them was a well-executed call center. A fixed call center was established in the cafeteria of the Ministry of Health, and soon a virtual call center was activated. Thereafter, Bahamians were requested to call 511, which is now the official Bahamas COVID-19 Information Center. Persons accessing 511, he's got a lot, can receive direct care for surveillance unit if they've been tested positive with COVID-19. They can make COVID-19 inquiries. They can report reactions to the COVID-19 vaccines. They can report workplace exposures and receive information on exposure protocols, and report violations to the public health measures or the emergency power order. Mr. Speaker, we've also seen the deployment of an array of digital platforms to respond and mitigate COVID-19. These strategies include a SharePoint customization for virtual call center, just spoke about it, and contact tracing. We have a digital quarantining verification solution. We have a digital Bahamas travel health visa portal. We have a digital workspace assessments tool. We have a digital vaccine appointment platform and a contact tracing certification course has been established.
Sound like a plan.
The associated combined cost for these technologies was some $2.2 million that was deployed during the COVID-19 pandemic. Mr. Speaker, as was said by Southern Shores, they say we don't have a plan. I think the Bahamian people know better. Mr. Speaker, I would be remiss if I did not explain to the nation the mammoth task that the Supplies Management Agency has been doing on behalf of the Bahamian people. Since September 2019, after Hurricane Dorian and COVID-19, and in March of 2020, the Supplies Management Agency, we effectively call SMA, of the Public Hospital Authority was charged with receiving and distributing all procured and donated supplies from donor agencies. Additionally, in early 2020, the Supply Management Agency's role was further expanded by the Prime Minister to be responsible for the procurement and distribution of all medical and surgical supplies, PPEs, required for the national COVID-19 vaccine. Mr. Speaker, on behalf of this government, I wish to extend my thanks and gratitude to the entire staff of SMA for a job well done. For the period January 2021, SMA distributed a total of 944,456 pieces of personal protective equipment throughout the entire health sector in the country. This total comprised of masks, gowns, head, boot, and shoe covers, face shields, gloves, overalls, hand sanitizers, disinfectant, safety goggles, thermometers, and PPE equipment. Mr. Speaker, here's another part of our plan. A key part of our detailed plan for the mitigation of COVID-19 is vaccination. We knew before COVID-19 that we live in an interconnected world. COVID-19 just doubled down on this reality, underscoring the mantra that none of us are safe until all of us are safe. Related to COVID-19, vaccinations help us collectively to get to a safer place of complete reopening of the economy. I want to say that again, Mr. Speaker. Related to COVID-19, vaccinations help us collectively to get to that safe place of completely reopening the economy, reuniting on all fronts with our loved ones and relatives, and recording lasting moments with those we love. Mr. Speaker, as of the 15th of June, Mr. Speaker, I want the Bahamian people to hear me. On the 15th of June, 2021, almost 2.2 billion vaccines have been administered globally. 2.2 billion doses of vaccines have been administered globally. Of this, almost 530 million, or 24%, were administered in the regions of the Americas. Mr. Speaker, it has been exactly 13 weeks since the Bahamas commenced rollout of the AstraZeneca vaccine to the public. To date, 87,200 vaccines have been received in the country, and some 20,000 doses were a welcome donation from the government of India. The remaining doses were procured by the government through the Powerhouse COVAX facility and delivered in 2 equal allotments on the 30th of March and the 11th of May. The third and final allotment through the COVAX facility of some 36,600 is expected before the end of June. After this third allotment, the Bahamas would have access to a total of some 120,800 vaccine doses, inclusive of the donation from India. The government of Bahamas redirected $2.4 million to ensure its access to vaccines through COVAX. And, Mr. Speaker, we, as an administration, is currently burning the candles on both ends to ensure and to secure additional COVID-19 vaccine doses. Mr. Speaker, the access of COVID-19 vaccines is of little use if we do not roll up our sleeves and get the shot. As of the 15th of June, in the Bahamas, a total of some 70,573 doses have been administered. 51,099 first dose, and 19,474 persons have received their second dose and is fully vaccinated. Mr. Speaker, based on the Department of Statistics projections, it is estimated that in the year 2021, there will be some 272,000 adults aged 20 years or older in the Bahamas. This translates to an 18.8% of our population receiving the first dose of the vaccine, and some 7.2% of our population having completed the vaccine schedule or who are now fully vaccinated against COVID-19. During the recent 74th World Health Assembly, Dr. Tedros, Director General of the World Health Organization, challenged the member states to achieve vaccinations of at least 10% of the population of all countries by the end of September 2021, and at least 30% of the entire population by the end of this year. Mr. Speaker, in our local context, we believe this to be achievable, especially when we take stock of the age grouping with the lower uptake of the vaccine. This age grouping is the same age grouping accounting for the largest COVID-19 disease burden, those 49 years and under. Specifically, of the total dose administered in the Bahamas, 8.9% were administered to those 20 to 29 years of age, 12.8% to those 30 to 39 years of age, and 17% to those 40 to 49 years of age. Our path to normalcy rests heavily with these age groupings. We can get to 30% in the first instance before September, Mr. Speaker. The nation needs your cooperation, not competition or confrontation. I want to say it again to the Bahamian people. We need your cooperation. Mr. Speaker, Philippians 2:34 admonishes us. I want to say this, Mr. Speaker. Do not do anything out of selfish ambition or vain conceit. Rather, in humility, value others above yourself, not looking to your own interests, but each of you to the interests of others. We are to be our brothers. There has never been a more ripe and opportune time for the scripture to minister to us. Mr. Speaker, we have heard of Bahamians who opt to receive and complete their vaccine schedules in another jurisdiction, the United States, for instance. If you are a university student or temporary contract worker who's returned home, or you just decided to have your vaccine administered in another country, we would like for you to tell us so. We would like for you to go to visit vax.gov.bs and let us know you have been fully vaccinated. In doing so, this gives us a truer picture of our vaccination profile in country. So again, I ask you to visit vax.gov.bs and fill it out. Mr. Speaker, vaccinations are a critical next step for us as a country to move beyond the COVID-19 pandemic and achieve our individual and collective goals. Dr. Miharan Javed, consultant in later life psychiatry, admitted, I had the vaccine not just to protect myself, but more importantly, to protect the vulnerable people I serve. Shervin Imran, a consultant child and adolescent psychiatrist, advised, although the effects of the vaccine can be a bit uncomfortable for a couple of days for some people due to common side effects, which I also experienced, like muscle aches and tiredness. This seems nothing compared to the pain that the COVID-19 infections can potentially cause to ourselves and to others. Mr. Speaker, Stephen Johnson, Catering Operations Manager, explained, I had the vaccine because I wanted to help protect my family, work colleagues, and service users that we care for. I am hoping that by being vaccinated, that this is the start of the normality and a returning to our lives in the near future. And I can't wait. And I am really looking forward to the time when I'm able to visit with friends and family unabated. End quote. Mr. Speaker, receiving the COVID-19 vaccination is not a governmental mandate. However, delays in the uptake of the vaccine by the eligible population will continue to place us all at risk. Risks that not only involve COVID-19 infections, but severe illness and potential death. Vaccinations can eliminate economic challenges brought on by measures taken to contain the spread of COVID-19 and prevent delays in restarting the tourism economic engine. Mr. Speaker, it is without question that this is a defining moment for the world's history and for our history. To those of you who purport that vaccines are not safe, we hear you. To those of you who believe that vaccine to be a conspiracy, we hear you too. But as the saying goes, the proof of the pudding is in the eating. And what is that proof? 2.2 billion persons having been vaccinated. Mr. Speaker, in our local context, less than 2.2 billion, there's about 7.3 billion people on the planet, so that's almost 1/7 of the globe. It is actually, the member for Elizabeth says it's actually 2.5 billion now. Mr. Speaker, in our local context, less than 1% of those who have been administered the vaccine, well, globally, less than 1% of those who have been administered the vaccine has reported side effects. Less than 1% of 2.5 billion. For the Bahamas, this statistics is 0.005%, with no deaths being attributed to the COVID-19 vaccine administered here in the Bahamas. I want to say it again so people start putting some of these things out on social media. There have been no deaths attributed to the administering of COVID-19 vaccine here in the Bahamas. As the vaccine performance in the real world, not in the lab, is continuously evaluated by scientists, there's growing confidence around the COVID-19 vaccines, their efficacy and safety. In fact, an April 2021 article in The Lancet found that the side effects from COVID-19 vaccines occur at frequencies that are lower than actually was reported in the phase 3 trials of those vaccines. The latest WHO data informs that globally there has been a 15% reduction in new COVID-19 cases and an 8% reduction in death week over week as a result of vaccine deployment. Mr. Speaker, the actions of the Ministry of Health have accelerated. I want to say that, Mr. Speaker, the actions of the Ministry of Health have accelerated our national recovery plan, putting heads in beds, foods in mouths, money in pockets, and bodies on the job. Mr. Speaker, the news headlines are replete with country after country after country that have achieved acceptable vaccination levels and are now ending COVID-19 restrictions. Israel, the United Kingdom, and the United States are but a few examples. Mr. Speaker, we in the Bahamas are headed there as well. Mr. Speaker, we stand firm on the guidance given by Galatians 9 and 6, which is, let us not grow weary in doing good, for in due season we will reap a reward if we faint not. Mr. Speaker, we are leading our people into a land of hope and promise, through a pandemic and through hurricane waters. Mr. Speaker, we are a people of manifest destiny, and this government, Mr. Speaker, is committed to the greatness of our nation's calling. For ultimately, Mr. Speaker, as we work, as we move our people from strength to strength, we know that the day is coming, Mr. Speaker, the day is coming in which the prophet Isaiah says that every mountain and hill will be made low, every valley will be exalted, the crooked places will be made straight, and the rough places shall be made smooth. The glory of the Lord, Mr. Speaker, shall be revealed, and all flesh will see it together, for the mouth of the Lord has spoken it. And we in this free national movement government will continue to work until that day. Mr. Speaker, I fully support this magnificent 2021 budget.
Thank you, honorable member. As many, Chair recognizes the honorable member for Carmichael. The chair recognizes the honorable member for Sutton Shore.
In fairness to the press, after all that was shared just now, I think in fairness, the press needs additional time to go and make the news, and we should take a break before we come back with another powerful presentation. And so, Mr. Speaker, I'm going to move for a suspension, but just before I do that, Bamboo emphasized the benefit of vaccination to the reopening of the economy. And someone shared with me earlier some anti-vaccination campaign. And I'm happy to say that I spoke with the deputy leader of the side opposite, who indicated to me that that side is not affiliated in any way, form, or fashion with this anti-vaccination campaign. And even though they haven't said it often enough, in my opinion, I'm pleased to know that they support vaccination. Mr. Speaker, I move that the business of this House suspends until 3 p.m. today's date.
Second.
Honorable members, it has been moved and seconded that the business of this House suspends until 3 p.m. this afternoon. As many members that are in favor will remain seated, those who oppose will stand. The business of this House stands suspended until 3 p.m. this afternoon.